You may or may not have heard of it, but basically preeclampsia is a condition that causes a woman's blood pressure to be really high at the end of pregnancy. So if you haven't heard that term preeclampsia, you might have heard of gestational, which means pregnancy hypertension. Sometimes we say preeclampsia, sometimes we say severe preeclampsia or preeclampsia with severe features, and all of that can lead into this terrible thing called eclampsia, which is what we're trying to avoid. So preeclampsia is a disease that comes from the placenta. So the hormones from the placenta that are circulating in the bloodstream, usually in the third trimester, rarely in the second trimester, but it can happen in the second trimester. Usually it's in the third trimester. And those circulating hormones can cause a mother to be very sick. And the easiest way to understand what's happening to her is if you can consider that her blood vessels are kind of being insulted by inflammation. And so she's inflamed. And so because her blood vessels are inflamed, they're a little bit leaky is the term that I would use to put in layman's terms. They're a little bit leaky. But what I mean by that is she starts to swell. But women with preeclampsia have more severe swelling. And that swelling can turn into swelling in the lungs, swelling in the brain, swelling in the liver. There's a couple things there's one main thing that we could do to try to prevent or lessen our chances of preeclampsia, and that is to take an 81 milligram aspirin every day. So we say baby aspirin. It's not because we're pregnant. It means it's just because it's a little dose of aspirin, 81 milligrams. But if you take an 81 milligram aspirin daily, it significantly reduces the chances that you're going to develop preeclampsia in the third trimester, or maybe you would get it, but it wouldn't be as severe. It's not necessarily that everybody should take it, but it certainly warrants a discussion. I do think every pregnant woman should have a discussion with her obstetrician about if she should be taking an 81 milligram aspirin to prevent preeclampsia. It's not. And the other thing to impart would just be that in the third trimester, if you were to start to get a severe headache or blurry vision, isn't relieved with Tylenol, that could be a sign that maybe there's something worse going on and you should call the doctor. Also, chest pain and trouble breathing. All pregnant women have some degree of this sensation of shortness of breath, but if it gets significantly worse in the third trimester, that's a reason to call the doctor. Also, if you have abdominal pain, kind of an upper abdominal pain, I always kind of go like this, like up here. It's almost sternal, but that can be a sign that the liver is swollen. If you have any questions, please call. And then hopefully you share this knowledge with your family and friends, because unfortunately it can lead to very bad outcomes, and it's good for all women to be educated about preeclampsia. So I am Dr. Scherbel. I work at Scherbel Clinic. We give superior care. Come see me.